Millions of Americans are following public health directives and stay-at-home orders to prevent the spread of coronavirus. But despite the risks, some bad actors have intentionally defied regulations and threatened to spread the disease. Under new direction from the Deputy Attorney General, these actions could be punishable by law under new terrorism charges. In a March 24th memo, Deputy Attorney General Jeffrey Rosen said that because coronavirus appears to meet the statutory definition of a biological agent under U.S. code, such acts could implicate the nation's terrorism-related statutes.
You need to use whatever levers you have to make sure people abide by those orders from your governors and that they don't, in the midst of this crisis, take advantage of their fellow citizens by engaging in criminal conduct.
The memo goes on to say that threats or attempts to use COVID-19 as a weapon against Americans will not be tolerated.
The reason is that a threat can produce real-world harm, right? If a threat takes law enforcement resources from one location where they're valued to another location, and that's a real-world consequence.
States and jurisdictions are rushing to find ways to keep infection rates down and suppress bad actors who put communities at risk. But why is law enforcement classifying the disease as a biological weapon? The CDC lists over 40 bioterrorism agents and diseases. Title 18 of the U.S. Code, cited in the Deputy Attorney General's memo, defines a biological agent as any microorganism, virus, or infectious substance capable of causing A, death, disease, or other biological malfunction in a human, animal, plant, or other living organism, B, deterioration of food, water, equipment, supplies, or other material of any kind, or C, deleterious alteration of the environment.
It's a very general, open definition. And so the fact that COVID falls under the legal definition of a biological agent is not necessarily surprising, nor particularly controversial.
A biological agent is considered a biological weapon when people choose to use it to harm or threaten someone. While COVID-19 seems to meet the definition of a biological agent, some public health experts say it may not be a very effective one.
This pivot point comes when you start to hear stories and you've got this fear, you've got this anxiety, you have this sense that this behavior is going to make us all at risk. So we tend to overreact and overdo the resort to punishment. It's an overreaction because this kind of behavior is pretty much rare.
If one country or one group was trying to use it, the problem is it's going to boomerang against them. They cannot be protected, right? There's no antidote. There's no vaccine that the perpetrator of this crime could use to protect themselves. So it's not a very smart terrorist weapon.
In a February intelligence brief, the Federal Protective Service warned that white racially motivated violent extremists have recently commented on the coronavirus, stating it's an obligation to spread it should any of them contract the virus. Law enforcement and minorities are the primary targets, and spraying saliva from spray bottles on the faces of law enforcement and leaving coronavirus-laced items at crime scenes for investigators to find were just a couple of the tactics communicated.
We've seen in the past a handful of cases in which individuals who have been infected have knowingly infected others and intentionally infected others. So it's not unprecedented, but it's rare.
Federally, using a biological agent as a weapon could land you in jail for up to 10 years. If a death occurs, charges can escalate to life in prison. Throughout the country, we have seen reports of what New Jersey Governor Phil Murphy calls knuckleheads.
A few knuckleheads, the Knucklehead Hall of Shame.
In Texas, and in New Jersey. After charging this last man with making terroristic threats, New Jersey Attorney General Grewall sent a press release saying that if you threaten a cop with COVID-19, you will face the maximum criminal charges.
Terroristic threats ordinarily are a third-degree offense when someone makes terroristic threats, but the statute contemplates that if you make those threats during a period of emergency, the charge is elevated.
Grewall told CNBC that the decision to charge people with terroristic threats was a gradual one, as the state has seen its law enforcement depleted after hundreds of police tested positive and thousands more are quarantining.
We started off softly by issuing disorderly persons tickets and using lesser charges, but when the conduct didn't subside and when actual officers were testing positive after interacting with people who spit on them, we had to step up our efforts and use all tools at our disposal, including the second-degree charges, which carry 5 to 10 years in prison.
The law doesn't differentiate if the perpetrator actually had COVID-19 and made a threat or not.
And so whether or not you were able to actually infect somebody is immaterial to the particular charge that we're bringing.
Around the country, people have been charged with other crimes, including assault and breach of peace.
You know, the use of biological weapons has been a part of warfare, both ancient and modern. And of course, these are political actors. Extremists are political actors who often see themselves as engaging in a total war. And so the idea that they draw from tactics and techniques used in war is not that far afield or that much of a stretch.
Biological weapons have been used in war for millennia, some say as far back as 600 BC. Tactics have included polluting an enemy's well water, poisoned bullets, and using smallpox-infested clothing to infect enemies. After evidence of chemical warfare during World War I, the Geneva Protocol of 1925 was drawn up and eventually signed by over 100 nations over the decades, and prohibits the use of chemical and biological weapons in war. But because there was no language on verification or compliance, countries continued to develop their own chemical and biological arsenals, including the U.S. In 1969, President Richard Nixon renounced the use of biological weapons and through executive action stopped the offensive production and research of such materials.
I have decided that the United States of America will renounce the use of any form of deadly biological weapons that either kill or incapacitate.
But research was continued on defensive countermeasures, like vaccines. By then, the U.S. had several standardized biological weapons, including anthrax. In the 1980s and 90s, jurisdictions around the country began to criminally prosecute people who spread another kind of virus, HIV/AIDS.
So a lot of people started looking at HIV from the position that bad people got this bad thing by doing bad things. And so obviously, if you thought that way, you needed to punish them and deter them because they were basically sort of criminal-like people. Policymakers pushed it. Jesse Helms was a senator from North Carolina. He used the federal spending power to try and make sure that every state in the U.S. had a penalty they could use, a crime that they could charge someone with.
Despite changes to U.S. policy in the 2010s, in 2019, there were 29 states that had HIV-specific criminal laws, and some states criminalized low-risk or negligible behaviors that could spread HIV, like spitting or biting.
It took a long time to get to the point where we could accept that HIV was, a virus and not a crime.
30 years of HIV criminalization, who are being stopped, who are being criminalized for transmitting HIV, and it's overwhelmingly vulnerable populations. Meanwhile, the epidemic continues, right? So we need to really be careful about criminalizing disease.
The worst biological attack in the history of U.S. law enforcement was the anthrax scare following September 11th. Envelopes containing anthrax were sent to several media outlets and politicians, killing 5 and infecting 17 others. The American people were afraid to check their own mailboxes. The ensuing investigation was the largest and most complex in the history of the FBI. In 2002, the National Biodefense Analysis and Countermeasures Center, NBACC, was founded to study threat assessments and bioforensics. As states continue to use all the tactics at their disposal to combat the pandemic, states are also looking to the future.
One of the things that we're doing is we're developing that playbook as we go along. We're writing down the things that work. We're writing down the things that we could have done better. So when we do that after action, we could leave something for the person who follows us. And so they could respond more quickly in some cases than perhaps we did.
It remains to be seen if prosecution will prevent people from making these threats or launching attacks.
The idea that we're going to spend, social resources to put some idiot in jail for 20 years as a bioterrorist because they, in a moment of really poor judgment and lack of self-control, they, pretended to have COVID virus and coughed on somebody. It's the wrong way to think about knuckleheads.
It may have a deterrent effect against those individuals who might be doing it as a sort of a counterculture response, some kind of joke taken too far. But for those who are really immersed in the kind of extremist propaganda that's pushing for this, I don't know that it's that effective of a deterrent.